I wasn't having back pains, I wasn't hurt or any auto accidents. I went there for total health.
I've had pain for probably 30, 40 years.
My legs were uneven.
Motorcycle collision.
Had a pretty bad spill.
Car accident and hospital 45 days.
I've struggled with very, very painful periods.
Pills didn't work anymore.
I tried muscle relaxers and physical therapy, but they weren't working.
I've never really gotten any satisfaction from my doctor.
My wife said, I think you should go see a chiropractor.
Hello. If you're new to chiropractic, welcome. If you've enjoyed chiropractic care in the past, welcome back. If you're like most people, you have some questions about what you can expect on your visit today.
When you first begin, it's kind of scary.
The first visit was actually great.
I felt so cared for.
The atmosphere of the office is very light.
You get to know everybody in the office.
It was very welcoming.
I felt really comfortable with them.
Initially, we sat and talked.
She cued in on who I am as a person.
Described everything very carefully and before they did anything.
Thorough explanations of what they're doing, why they're doing it.
I could tell that he cared.
He's a really cool guy.
After I'd filled out some paperwork, I met the doctor and we discussed my problems.
She explained what she was finding during the examination and I felt involved.
First, realize that chiropractic is different than traditional medical care. Instead of treating symptoms with drugs or surgery, chiropractic care is mainly concerned with the integrity of your nervous system. Why the nervous system? Because your brain, spinal cord, and all of your nerves control and regulate every cell, tissue, and organ of your body. Your nervous system is the master system that controls your heart, blood, stomach acid, your immune system, and trillions of other details. If your nervous system doesn't work right, you don't work right. And when you don't work right, you're not healthy. It's as simple as that. Now, your brain is such an important part of your nervous system, it's encased in bone, but your spinal cord is a different matter. Your spinal cord is the information superhighway of your nervous system. Instructions to and from your brain travel this vital pathway. Your spinal cord is covered by 24 moving bones. Nerve roots, one on each side, exit the spinal cord from between each spinal bone to connect your brain to every part of your body, from your nose to your toes. But each bone can move in many different directions. So if one or more of these spinal bones doesn't move right, it affects nearby nerves. One of two things can happen. The least common is a pinched nerve. Now, it's easy to see how a nerve might be pinched, but actually it's quite rare. I'm told only a fraction of chiropractic cases involve a pinched nerve. Instead, it's more likely that nerve tissue is stretched, chafed, or irritated in some way. This inflames adjacent soft tissue. Like a short circuit, nerve impulses become distorted, confusing your brain's ability to properly control and regulate your body. This is called the vertebral subluxation complex, or more simply, a subluxation.
I did need x-rays because of the car accident I was in, but the children didn't have any need for that.
I can't even remember ever having an x-ray.
I kind of like the idea of x-rays.
It gave him a better idea of where my problem areas lay.
This is what the side view of the neck should look like. This is the shoulder, and up here is the jaw. From the side, the neck should have a graceful forward curve, and there should be equal disc spacing between each bone, and the openings for the nerve roots should be clear and unobstructed. Many everyday activities can produce subluxations. These traumas, micro-traumas, and repetitive motions can stress the spine, as can drugs, alcohol, pollution, tobacco, poor nutrition, preservatives, and chemicals that affect the nervous system and the muscles that support the spine. Even our thoughts and emotions can affect the spine. Stress, fear, grief, and other emotions affect our posture, our muscle tone, and our ability to function normally. Neglected, these spinal injuries produce a predictable pattern of spinal decay. First, in phase 1, there's a loss of curve and a reduced ability to turn and bend. If neglected, in phase 2, joint surfaces get rough and uneven. They thicken and the decay becomes visible as the early stages of bone spurs begin to form. If still neglected and left uncorrected, the problem worsens in phase 3. Almost as if the body is trying to mend a broken bone, spinal joints fuse together. The primary form of care in this office is called a chiropractic adjustment.
There are an awful lot of adjustments and types of adjustments in a chiropractic office.
It can be surprising.
Kind of stretches you out a little bit.
You can feel it. There's kind of a pressure.
They'll push down gently.
It's just a subtle little movement.
It felt really good. I felt like a marshmallow or something.
I find it very relaxing, very nice.
Some are a little more aggressive. Some use hands. Some use mechanical instruments.
It's like a little clicker thing.
It's a feeling of release.
There are lots of different ways to adjust your spine, and your chiropractor has become an expert in one or more techniques so that you can get the best results in the shortest amount of time. Now, some people enjoy quick results, and for others, improvement can take several weeks or more. Since your body is doing the healing, not the chiropractor, results will naturally vary from person to person.
Progress was a little slow at first.
It's an instant relief.
It took us 6 months to get me back walking.
Instant repair.
I think it took probably about 2 or 3 weeks before I sensed a major shift in the pain level.
And how long will you need chiropractic care? It depends on your goals. Some people just want temporary relief. Others want to retrain and strengthen their spine so that they can avoid a relapse. And a growing number of people adopt a schedule of periodic wellness visits so that they can be their very best.
Once you know what your body is saying to you, you know when it's time to go to the chiropractor.
I keep going for the maintenance part.
If I maintain a schedule now, I'm pretty much pain-free all the time.
I know that there's other benefits than just no pain.
To get the best from your chiropractic care, keep your appointments. Each visit builds on the ones before, so missing a visit can slow your recovery and jeopardize your results.
You have to kind of stay with it and be willing to make a little bit of effort to get some relief.
I usually can run over in my lunch hour or an hour before work, and I can jump in and jump out, and I'm finished.
Second, become more active. Research shows that bed rest or a sedentary lifestyle can actually slow the recovery process. Recommendations may include exercises, stretching, swimming, or brisk walking. And this would be a good time to adopt other healthy habits such as drinking more water, improving your nutrition, and getting the proper rest. Ask about specific home care procedures that can enhance the healing process. And finally, keep a positive attitude and remain hopeful, knowing that chiropractic care has helped millions with a variety of health problems. Ask questions and stay involved. Those who do seem to get well faster. Your health affects everything you do and everyone you know. This office is committed to providing you the best chiropractic care available, and it's up to you to decide how much of it you want.